So that's a perfect introduction for our next speaker, that is Dr. Larisa Carrera, who is the Vice Chancellor of the Universidad Nacional de Litoral in Argentina. She also was a past and one of the founding deans of the School of Medicine at the Universidad Nacional de Litoral in Santa Fe, Argentina. So for me, it's an honor and a privilege to introduce her. I also consider her my, scientific sister, because we share the same mentor. So with all that, is honored to give the floor to Larisa.
Hello, Veronica. Thank you very much. Thank you, everyone, for the invitation. It's a great pleasure for being here. My scientist sister. Okay, this is a good name for our relation. So I'm very happy for being here. I propose to talk about health and sustainable development. So I want to share with you my screen so I can start to talk with you about some aspect about this topic. I propose to talk about health and sustainable development and the role of intersectoral work in health. And we are going to talk about the importance of reducing inequities in health in order to work for human and sustainable development. Of course, all of you know that we have 17 goals for sustainable development. The United Nations proposed these 17 goals, and look at the first 3 of them that are no poverty, zero hunger, good health and well-being for everyone. And something that is important to say is that these 17 goals are related to human rights. And besides, in relation to health, we have to consider several aspects that are important, that are included in the complexity of the concept of health. You can see here some information that is important, because when you think about health, you think in human rights. And when you think in human rights in relation to health, sure, you think about right to life, right to health, a special protection to mother and children, right to enjoy the benefits of scientific progress. Of course, you think in all about these rights. And so you noticed that health is important. The concept of health is very complex, but health is central to obtain and reach sustainable development, human development. And look, all of us live in the Americas region, and I want to share with you some information about health in the Americas. The access to comprehensive health services is still a big problem in our region. In Argentina, in Brazil, in Colombia, in Peru, there is a low use of preventive health services. Only 15 to 21% of the population have at least one preventive health visit per year. Another data, only half of the people with chronic non-communicable diseases like diabetes or hypertension are diagnosed, and only half of them receive treatment, which is effective in only 1 in 10 cases. So we have a problem in our region. For instance, there is still a high maternal mortality in our region, more in some countries than in others. And more information I can share with you. Here you can see 30% of the population doesn't have access to healthcare due to geographic barriers or gender barriers or social barriers or economic barriers. And in 2020, the 25% of the world population doesn't access to safety drinking water services. And that is a very big problem, because you know that a lot of diseases are related to poor water, to unsafe water. So nowadays, international organizations of health talk about social determinants of health when they are talking about a health profile of a social group, of a community, of a population. And what do this mean? When we talk about social determinants of health, we are talking about several things, several factors like water, as you see in this picture, like sanitation, like employment, like poverty, like education. Those factors are related to health. Who can think about health with poverty or with insufficient water? Who can think about health without employment? And this is a very big problem in our region. So to work for health development, we have to promote intersectoral work, because we have to face all of these challenges, all of these problems that I showed. Pan American Health Organization says inequity and inequality in health continue to be the main obstacles to sustainable development. And I have to say that in 10 countries of our region, there is an absolute deficit of health workers. We have serious inequalities in the availability of health workers between urban areas and rural areas, which generates greater problems of access to healthcare. And a lot of researchers have documented inequalities in the distribution of health and have measured using many different outcomes, including infant death, mortality rates, disability, life expectancy. And when we are talking about life expectancy, for instance, I must say that life expectancy for women living in the most deprived regions of the world used to be between 5 to 10 years shorter than for those who live in other regions. There is a difference in life expectancy by gender too. The population of many of the richest countries in the world have life expectancies of over 80 years. As you see in Spain, in Switzerland, Italy, Australia, was over 83 years. And in Japan, for instance, is about 85 years. But in countries like in some population in Africa, is between 50 and 60 years. So I must say, although that life expectancy improved in all countries in the last century, but of course, in some of them, more than in others. So social inequality may affect people's health. Health reflects the patterns of social, psychosocial, and biological advantages and disadvantages. We can affirm that health is crossed by many factors and that it is necessary to work on each of these factors in order to work with the goal of improving the health of the population. We can improve health with policies that face all of these factors, each of these factors. And that is why we affirm that health is in all policies. And all policies have an impact on health. And Pan American Health Organization said that health has long been recognized as a manifestation and as a result of the dynamic interaction between individual biology and social, economic, and environmental aspects. And therefore, they can only be transformed through coherent, coordinated, and equity-promoting intersectoral policies. And for the last minute that we have, I want to share with you this concept. We have to promote health, equity, and sustainability, but we have to promote health, equity, and sustainability, incorporating health, equity, and sustainability into specific policies and into government decision-making processes, so that healthy public policy becomes the normal way of doing business. Health in all policies is built upon the idea of co-benefits and win-wins. Health in all policies should benefit multiple partners. This concept can reduce redundancies and ensure more effective use of scarce government resources. This is very common in our countries. Health in all policies engages a variety of stakeholders, such as community members, that is very important, policy experts, advocates, members of the private sectors, and the work must be responsive to community needs. The health sector can't work alone. The design and the implementation of public policies in health that improve well-being and equity in health of the population requires the commitment and active involvement of other sectors in all steps of the processes. And of course, there must be an engaged community in the process for the policies to be most effective, because all the policies are related to health, and health must be in all policies. So central and local government, health system, private sector, individuals, community must work together. Thank you very much. And thank you for the invitation. And I expect the questions that you have about that.
Yes, here. I would like to know if there's any case of success in health in all policies to illustrate, because we've been working in this concept, that perhaps you can illustrate with some concrete example that already exists. It can be like local level or any country that is like leading this conversation.
Yes, of course, success policies in health. We improved a lot of indicators in health in the last century, but we still have another challenges in health that we can face today. And nowadays we have a very important problem about mental health. After the pandemic, this is a big problem for us, and we have to face together these kind of problems. Of course, we are facing challenges every moment, and we have successful experience in facing these challenges. You notice life expectation was improving in the last century. So this is about the policies that we can face, or we can design to face these challenges.
So thank you for your comments today. I'm just going to walk around so you can see who I am. I wonder, given the intersectionality, how you have seen the various countries' mechanisms of financing healthcare as affecting these outcomes, and which financing structure for the healthcare system you see as most effective.
Well, working in an intersectoral way of work is very important to face these kind of problems, because we have to face together some kind of problems that only in the health system we can't face. Some of them related to the access of water, to water, or to other kind of problems like geographical barriers, for instance. So I think this way of work is very important to our local governments. In our local governments, we have to think about this kind of work together, because this is the way to face these challenges. And we have several and important examples here in Argentina. In my province, in Santa Fe, we have an important work, an important research work from Ernesto Váscolo, that is a professor of health, I think it's in Universidad of Rosario. And we can share with you this work, because he shows that when local governments work together and in intersectoral way of work, they can face more successfully the challenges that they have.
So I have a question, and we asked a similar question to some senators and representatives here in New Mexico. And it's about how to make this approach of health in all policies operational, both in a legislature and in the executive, because sometimes health commissions or health ministries work in an atomized way. So I was wondering if you could mention if you knew any successful mechanisms in which this approach can become operational in these two strands of the government. Thank you.
Well, I think the way is working as a group, getting together, meeting, making political decisions. I think this is a way to work together to face these kind of challenges. You have to make the decision, to take the decision.
So to do that, to offer, it's like go from the plan to the action, is to make that choice that will be the way of work. And I don't know if you like to talk a little bit about during the pandemic, the work that the university was involved and how that intersectoral collaboration was happened in Santa Fe, and what was your role?
Well, in pandemic, we worked together with the health system, and we trained about 500 of workers, health workers, in putting all the protection clothes, and we train them in our simulation center in our School of Medicine, and 500 workers were trained. So we work together in the decision-making progress We work with our expert in several fields of health, and the work of the university was very important and was recognized for the community, by the community, and also the health systems and the Ministry of Health here in Santa Fe. We work in the field, we can do the test and something like that in the call center, and we work together in several aspects of the pandemic problem and work.
Larisa, can you comment a little bit in terms of the role of the university in the extension, what that means in terms of intersectoral collaboration?
Well, extensions is a concept that we have in Argentina and in a lot of countries in Latin America that comes from the reform of the university in 1918. And this concept is related to the relation between the university with the community and the social accountability that the university has with the community. And so in this concept, we design several works together, all of them in relation of the needs of the community. The community asks to the university for some help, and the university with the experts, with the researchers, with the students, go to the community and work together to face several problems or several challenges. This is the concept of extension that is the third function in our universities: teaching, researching, and extension. The three pillars of the university in Argentina and in some other countries in Latin America.
Well, there's just one also, because I don't know if Larisa will be here tomorrow, but for the presentations, but some of the case studies that we're doing with, at least with San Javier, are proposing like the collaboration with the university. So I don't know if the groups want to kind of maybe each group want to touch in terms of their proposed for collaboration.
Well, hello, Professor. I am Mariana from Entre Rios, so I hope that we can meet someday in the future.
Hola, Mariana.
Our team is thinking about projects where the university can work with the San Javier local government to teach and bring capacitations to the rural actors in the territory, and also to incentivize research approaches and projects about agricultura familiar.
Agriculture.
Exactly. So we hope that we can continue working on that line, and you can participate in future projects about that.
Well, thank you very much, Mariana. This is very, very interesting. We invest several time, work, and effort in working with the community. San Javier is a population very near to Santa Fe that works with us, and we are working in different aspects with San Javier. And you are very welcome if you want to come and visit our university and work with us in some of these lines. For example, in health, we have a rural health program in our School of Medicine, and some of our students are working in the last year of our medical program and our other health programs in San Javier. So we are working together, and we are going to design new lines of work, because the rural program in our School of Medicine involves other kind of activities, like training to the health workers of the health system in San Javier, or working together in agriculture and family agriculture, or different aspects in water, for instance, in urban design. We are working together in several aspects, because in our Secretary of Extension, our Vice Rector, Rectorate of Extension, we have different lines of cooperation between the university and the small towns in our province. We have a program that is called Munigestión, in where we can work together with several small towns in our province, and we are working now in the internationalization of these populations of these towns, and in the relation with of these towns with other towns in other countries. So we are the medium, we are the way to cooperate with this kind of population and to internationalize their city, their town, and their activities. In tourism, for instance, is very important.
Hi there. Hi. Here, yeah. How are you? So I'm part of the group which will work with the productive development, or the idea is to approach that area of the San Javier situation. So understanding that one of the reasons or one of the roots of the problem of that population has to do with lack of development and lack of employment, which was one of the areas that you mentioned, that it's an obstacle or a difficulty in terms of health access as well. So we're thinking how to develop a strategy in terms of improving the access to quality employment, formal employment, and that will have, or we expect it will have an impact not only on the housing crisis and the floods that these populations suffers, but also health indicators, of course, because we understand that the quality of life and the health access has lots to do with employment. So considering the particular geographical location of the population of the town, we thought maybe tourism and ecotourism, so we can also have the environment and sustainable aspect of it involved in the project, could be like a really good opportunity and something to exploit in a good sense, to improve and to increase the workplaces and the quality employment of that area. So maybe if you can tell us a bit your opinion on your knowledge about this bond between employment and quality, employment and health, that would be great. Thank you.
In this year, we are working together in the winter school with San Javier, because San Javier is a population that works with us in several projects. We are thinking in taking our students in moving to San Javier when we are implementing the winter school, so that they can get to know the situation, the city, the population, and see in situ how is San Javier and how to work with this population, with this town, with this small city. Of course, in some areas, we can collaborate directly, as in health, for instance. In health, we can collaborate directly by bringing advanced students to work there and cooperate with the health systems and the health workers and the teams that are there. But of course, in some areas, we can collaborate only with ideas, not with specific lines of work. But in tourism, we can, for example, make the area known and bring visitors who perhaps we love the area. We love what we know. So It is important to San Javier to be known for the visitors and international visitors that we have in our university, and also for our students. And it's important for us to work together. And in this year, we have our pilot experiences in that. So I think it would be very, very great